Hello doctor and friends, this is SGDB5 and we're going to present our work titled The Anatomical Aspect of Meniscalation. And this is the list of our members. My name is Niban Sifa with the last third digit 121 and I'm going to tell the background of this project. The knee has the largest and the most complex joint in the body. There are so many important structures in the knee joint, including cartilage, ligaments, bones, and tendons. This joint is a very active joint. Of course, there are a lot of injuries that will possibly happen. One of the very common lesions is called meniscalation. In order to make an accurate analysis and diagnosis, the complex of knee joint need to be well studied. A thorough knowledge about normal human anatomy will also be the basis on how the treatment will be performed. Through this project, the information about normal knee anatomy and its function will be provided. Not only that, the information about the meniscalation will also be provided, including the definition, diagnosis, causes, symptoms, treatment, prevention, and rehabilitation. This information is intended to give a better understanding about it.
Okay, next one is problem formulation and objective of the student project. Let me introduce myself first. My name is Stanislas Data with NIM 21025111115. So next up is the problem formulation and the objective. In regarding to writing our student project, we need to have clear problem formulation for the base and the objective in order to reach the clear goals for our student project. Problem formulation that we have created, the first one, how is the anatomy form of the knee? We started our problem formulation with something general, which is the knee as the big part of the meniscalation. The second and the third part, what is the definition of the meniscus and what is the function of the meniscus, which is more generated in order to gain more specific information and regarding towards the meniscalation. The next one, we started to get even more specific to the meniscalation. The fourth one being, what is the definition of the meniscalation? The fifth one, what are the diagnoses towards meniscalation? The sixth one, what are the causes of meniscalation? The seventh one, what are the symptoms of meniscalation? The eighth one, what are the treatments for meniscalation? The ninth one, what are to prevent meniscalation? The 10th one and the last one is how to rehabilitate meniscalation. So in order to create or answer those problem formulation that we have created before, we have certain objectives that we need to gain or to complete in order to answer those problem formulations. The first one, to answer how is the anatomy form of the knee, we need to understand the anatomy of the knee. The next one, to understand the definition of meniscus. Next one, to understand the function of meniscus. 4, to understand the definition of meniscalation. 5, to understand the diagnosis towards meniscalation. 6, to understand the causes of meniscalation. 7, to understand the symptoms of meniscalation. 8, to understand the treatment for meniscalation. 9, to understand the prevention of meniscalation. And 10th, to understand the rehabilitation for meniscalation. Next one is the benefit of research. Of course, in creating our student projects, there are certain benefits that we can gain in order to get it into ourselves. The first one being students can analyze and understand the anatomy of the knees as the first and second problem formulation as well as the objective. Next one, students are introduced to meniscus as a part of meniscal studies. Next one, students get to identify and comprehend more about the meniscalation. Next one, students are more exposed to the terms regarding to the medical word. Next one, students at least own the theory of practical condition of the meniscalation.
Let me introduce myself. My name is Zafira Kumaladewi, with the last 3 digit of student number is 122. Now I will explain about the anatomy of the knee. Knee is one of the most easily injured joint in our body because it bears with our body weight. It is important to support our posture. Upon standing, knee is positioned inferiorly from the trunk to maintain the center of the gravity. Knee is part of the lower limb, specifically in the knee region. Knee itself consists of 4 main components: bones, tendons, ligament, and cartilage. The osseous part of the knee or bones in the knee region is divided into 3 bones: femur, patella, and tibia. First, femur. Femur consists of a shaft or body, proximal ends, and distal ends. This bone is the longest bone in the human body. Femur articulates with both patella on the patellar surface and with tibia on the tibial condyles and femoral condyles. Next, patella. Patella or kneecap is a triangular shaped bone, or it usually referred as a sesamoid bone. As you can see in the PowerPoint figure 1C, it shows the anterior view of patella. This shows that patella is a triangular shaped bone. Patella is located in the most anterior part of the knee and articulating with the distal end of femur on the patellar surface. The patellar surface can be seen on the PowerPoint figure 1D. But the patella doesn't articulate with the tibia itself. This articulation forms the knee joint complex. Anatomy of the knee joint complex will be explained by my friend Novea. That's all from me. Thank you.
Hello, let me introduce myself first. My name is Novea Indratmo and the last 3 digits of my student number is 119. After discussing the general anatomy of the knee, let us discuss and dig further into the anatomy of the knee joint complex itself. This picture shows the anatomy of the knee joint complex from a sagittal view. The knee joint complex is made up of the articulation of 3 bones, the tibia, the femur, and also the patella. It is a hinge joint and it allows reflection and extension movements. It also facilitates lateral and medial rotation. The knee joint is a synovial joint and it has an external fibrous capsule and the internal synovial membrane, shown by number 10 and the one below it. The synovial membrane contains synovial fluid, which is fluid used for lubricating the knee joint complex. There are also some structures called the bursae, which are small fluid-filled sacs, like the ones as shown, the subcutaneous infrapatellar bursa and the subcutaneous prepatellar bursa, etc. These bursae act to reduce friction and to provide cushion for the knee joint complex. The next picture shows the anatomy of the knee joint complex from an anterior-posterior view and a lateral view. These pictures clearly show the articulation of the 3 bones making up the knee joint complex, and you can see that the fibula is not directly part of the knee joint complex. Finally, the next picture shows the knee joint complex from a superior view. As you can see, there are structures called the menisci, which is plural for meniscus. There is the lateral meniscus and also the medial meniscus. The menisci are fibrocartilage discs, which plays a big role in the knee joint complex as it provides shock absorption for the knee joint complex. Other than that, to support the knee joint complex, there are also several ligaments as shown in the picture. There is the fibular collateral ligament, the posterior meniscofemoral ligament, the posterior cruciate ligament or otherwise known as PCL, the tibial collateral ligament, the patellar ligament, and also the anterior cruciate ligament, which is otherwise known as the ACL.
Okay, my name is Gustu Muradina Pratiaksa with the last 3 digit is 1 and 12. So now I'm going to explain about the definition and function of the meniscus. So now the knee has 2 fibrocartilage discs which are called by menisci that are flat and curved fibrocartilaginous structures which are composed of water, collagen, which is in this case the most found is the type 1, and the other substances such as elastin, matrix glycoproteins, and proteoglycans. And the knee has 2 menisci that are the medial meniscus, which is in this picture is on the right side, and the lateral meniscus on the left side. And these menisci are located between the femoral and the tibial condyle. So now I'm going to explain about each of the meniscus. The first one is the medial meniscus, which has semilunar shape, and its posterior portion is wider than the anterior portion. Its posterior horn attaches from the posterior of intercondylar fossa to the anterior of the posterior cruciate ligament's insertion on the tibia. Meanwhile, its anterior horn located on the anterior of the anterior cruciate ligament. Besides of that, the body of the medial meniscus also attaches to the coronary ligaments, which makes the medial meniscus become immobile. And the second one is the lateral meniscus, which has circular shape and its anterior and posterior portion relatively have the same size. Its anterior horn located on the anterior of the intercondylar eminence and more lateral from the insertion of the posterior cruciate ligament on the tibial spine. and the posterior horn attaches to the posterior of the intercondylar eminence. Unlike the medial meniscus, the lateral meniscus doesn't attach to the corresponding collateral ligaments and has loose attachment on the joint capsule. So the lateral meniscus is more mobile than the medial one. Next slide, please. So in this slide, we can see that each meniscus has 3 layers of stratum. The first one is superficial layer, which directly contacts with the articular surface and is composed by the mix of collagen fibers and lubricating layers of the proteoid ligands, which can reduce the friction between the surfaces. The second is middle stratum, which is composed of the lamellar layer, which contains cross-linked collagen fibers and construct a strong tissue. And the third is the inner layer, is composed of circumferential fibers, which are the majority located on the internal and external circumference of the menisci. And with these layers, the meniscus become elastic and has viscosity to withstand the pressure and shear. So with those structures and characteristics, the menisci function in aiding joint stability, shock absorption, lubrication, proprioception, load transmission, and give nutrition to the articular cartilage. That's all from me, thank you.
Hello friends and doctors, I'm Christina Natalia with the 3 last digit student number 109. I'm here to present the meniscus lesion definition. As the shock absorber of the knee joint, the meniscus is very susceptible to trauma or injury. Meniscal lesions are the most common injury of the meniscus, which can occur during activities that require the knee to change directions, such as twisting, sustaining a direct blow, and squatting. This is according to the Portland Clinic on 2014. Moreover, the meniscal lesions are classified into 5 types according to Nguyen et al. On 2014. The first classification is longitudinal tears. Longitudinal tears of menisci mostly occur in young patients due to a carving force. A bucket-handle tear, which is a tear where the inner portion of the meniscus folds inward, can be a part of longitudinal tear. The second one is the horizontal tears, which is the tears of menisci that are commonly found in degraded menisci. In this case, the collagen layers are fracturing, causing detachment of the inferior layer to the superior layer of meniscus. These tears, however, usually extend to the inner margin of the meniscus, for example, the avascular zone. Therefore, it is not amenable to repair. The third one is the radical tears, which spread from the margin of the menisci towards the periphery of menisci. Moreover, radial tears of menisci is an injury that indicates a high-energy injury or a degenerate meniscus. The fourth classification is flap tears. Similar to the radial tears, it also extends across the inner margin. However, the tear runs obliquely across the meniscus. The tears also indicate a high-energy injury or degeneration and may have a tendency to fold into joints, causing mechanical symptoms. The last classification is degenerative or complex tears. Most of the degenerated menisci are not repairable since they have marked the arrangement of the collagen architecture, which causes multiplanar tears.
Oke, perkenalkan nama saya Bima Nipar dengan 3 digit yang terakhir 118. Okay. So now we are on the diagnosis. Meniscus is located in the knee joint anatomically. In the body, the knee joint is the most vulnerable to injuries. Anatomy and biomechanics of the knee must be well understood to diagnose an injury. With technological advancement, we can be helped to diagnose an injury by advanced imaging. However, in some cases, several examination tests are more accurate than the imaging method. Accuracy of the test can be increased by combining both of the examination test and the imaging method. So there are 2 kinds of tests that we could use to diagnose an meniscal lesion. So the first one is the imaging method. Okay. Middle-aged or more elderly subjects with painful knees typically don't use knee MRI or magnetic resonance imaging in the first lineup, but determining the existence of the meniscal lesion can be done by doing knee MRI to identify the pathology matching the symptoms. Location and extensions and any flat displacement can be known by doing knee MRI. Knee MRI can be collaborated with symptomatology, clinical examination, and also clean X-ray to suggest a surgical treatment, such as biofilms and Puyol. Okay. Magnetic resonance imaging or MRI in results will show a linear intrameniscal signal, which include a horizontal pattern of the component that often communicates on at least two image surface with the inferior meniscal surface. Okay, so that's on the imaging method. And now for the examination method, the patients that come with the knee pain or injury, which has an history, should be first identified by the clinician because the previous injury, sequela, may be the cause of the current injury or pain. Assessment of active and passive range of motion, or ROM, should be involved in the knee evaluation along with the inspection, palpation, and special tests. So there are several methods. There are actually three methods that we are giving here. Okay, so the first one is the McMurray circumduction test. Okay, so occult tears of the posterior horn meniscus is detected by doing McMurray circumduction examination. Lateral meniscus tear is tested by rotating the tibia internally to allow the knee to be extended. The tibia and knee later rotated externally and extended to test the medial meniscus tear. In this test, with flexion and internal rotation of the posterior horn of lateral meniscus that are brought under the lateral condyle cause stress, and the knee is extended. McMurray circumduction examinations need the patient to be able to do full knee flexion for the test to be able to be performed. This is because the McMurray circumduction examinations need the patient to be able to do full knee flexion for the test to be able to be performed. This is because of the design and of the test itself. For an already displaced meniscus tear, this test may not be helpful because it's designed to displace an occult posterior horn tear. So the next test will be a play grind test. This test was created by a play specifically aiming to differentiate rotational sprain from meniscus tear. This test needs to place the examiner knee over the patient thigh, just like in the image, to stabilize the femur. Thus, this requires the patient to be prone on the examination table for no more than 2 feet high. And the last one is the tessellate test. In this tessellate test, this is both more accurate in detecting meniscus tear and easy to perform in outpatients than the other existing tests. This test is performed by a patient standing on one foot fixed to the flat ground. The knee is fixed at an angle of flexion, approximately 5 degrees and first and continued with 20 degrees. The patient later will be asked to rotate their bodies internally and externally about 3 times while being supported by the examiner by hands. If there's any discomfort or popping on the lateral or medial side, it constitutes a positive test result. This test is less accurate when there are ACL or anterior cruciate ligament tears. Okay.
Hello, my name is Madani Lamra with last 3 digits 106, and I would like to explain about causes of meniscal lesions. Meniscal lesions are differentiated into traumatic meniscal lesions and degenerative meniscal lesions based on factors and causes. Traumatic meniscal lesions or traumatic tests occur if one leg is twisting whilst the knee is slightly bent. It puts pressure on the knee and causes a tear in the meniscus. Research states that traumatic meniscal lesions is commonly caused by a very minor trauma or significant and memorable injury on the knee, such as when walking stairs and doing some sports. Football, basketball, rugby, wrestling, and baseball are some sports which have a risk for traumatic meniscus lesions due to the frequency of twisting and pivoting movement in these activities. Men's risk for this type of meniscal lesions is higher because they are more aggressive when doing sports. This type of meniscal lesions usually occur in active people at a younger age because of the spontaneous movement that can cause the meniscus to tear. The other type of meniscal lesion is degenerative meniscal lesion, which commonly occurs in the medial meniscus, specifically on the posterior horn. It often occurs in middle-aged or elderly subjects and rarely found in younger age. As we are getting older, the structure of the meniscus gets weaker and its function will decrease. Of course, it will affect the knee in the long term, and the meniscus also becomes more prone and damaged easily. Even when the aged person is doing a little squat or getting up and accidentally twisting, it will cause a tear in the meniscus because of its prone structure. Several studies say that meniscal lesions can cause osteoarthritis, but on the other side, osteoarthritis can cause the meniscal lesions too. Osteoarthritis is a type of arthritis caused by the breakdown of the cartilage. It commonly occurs in older people. Meniscal lesions or meniscal tears happen as a result of degeneration of the cartilage, one of the common processes in osteoarthritis. Besides that, meniscal lesion can occur if the subject is overweight, doing intensive training, and other things that can increase the pressure on the knee and tear in the meniscus.
I will continue the presentations. My name is Luis Felix Juanda with 3 last digits 117. I will explain about the symptoms of meniscal lesions in the anatomical aspects. The first one is locking. Locking is when the patient experiencing having a particular movement unable to be completed, like unable to complete it. That is because of mechanical block when there is a trapped meniscus between the articular surface of the knee. This still allow flexions but prevent flexions of the knee, mean that your lower extremities still could do flexions but with limitations. The pain that is usually described by the patients is not a locking but unlocking. Unlocking is when the pertaining body slips out of the way. Then that's allow a full flexion of the but that is a painful one. Another sign is instability of the joint itself. Patients may feel like their joint jumps out of the way or gives way, something like that. That's unstable. If this happens frequently, this may be a sign of serious problem in the meniscus. For example, a torn meniscus. Next, the different patients have a different risk. People with special medical conditions like knee or osteoarthritis have a risk in the range of 75 to 95%, while all people with have a percentage of about 45%. But this is when he or she doesn't have any other special condition, because a special conditions can amplify the percentage even higher. 75 to 95% differs because how severe the disease is, and the percentage still like the old age, they can be even more amplified if there is more special condition that is related to the meniscus. What I want to say here is when a people with a special condition show a symptoms like just pain, they may have more concern to do a further medical examinations to make sure, because they have a higher chance to have a meniscus lesion up to 95%. This is for me. Thank you.
Hello, doctor and friends.
First, let me introduce myself. My name is Gracernica Wijaya with 3 last digits of student number 1 and 13. Now I'm going the presentation with the surgical treatment for meniscus lesion. In the last 15 years, the most common of surgical treatment for meniscus lesion is reduction of meniscal tears, which is usually done by closing the tears in the form of suture and or anchors. The other surgical treatment that can be used is meniscus allograft transplantation, which is the only way of total meniscus replacement, and it's aimed for patients with stable, properly aligned joints and early knee osteoarthritis. There are also other surgical treatment that can be used for meniscus lesion is synthetic implant, such as collagen meniscus implant, or known as CMI, and polyurethane polymeric implants, or known as ActiveFit.
Let me introduce myself first. My name is Glenn Felicia Auden with student number 21025111110. And here I'll be continuing what Grace has explained, which is treatments. Okay, as Grace has explained, there are surgical treatments for the meniscus lesion, but there are no non-surgical treatments too, which is therapy. So between therapy and surgery, which one to choose? Okay, so a study by Torland et al. Reveals that, and it is recommended that 40 plus years old patient with meniscus lesion to take the therapy route rather than the surgery route. Why? Because in the same study with small lesions, there are no big difference on patient reported pain between surgery method and therapy method. But however, there are slightly muscle improvements on the therapy method rather than like an arthroscopic knee surgery. While talking about this topic of treatment, I want to also talk about the good potential, which is currently on trend, is the stem cells. So stem cells is a good and great potential to develop in the act of treatment, because stem cells is contributing on the engineering of the scaffolds and implants improvement to be used on meniscus lesion. Okay, so stem cells is more effective than mature cells, and it is used on like injections, stem cells injection on the menisci, and also, as I have said, the engineering of the scaffolds, which can be used when we have meniscus lesion. And there is also a study by Whitehouse that 3 out of 5 of his patients that wears this stem cell scaffolds shows a positive signs by like signs of in situ repair. However, the 2 other patients experience repeated lesions 15 months after the surgery, which is unfortunate. And stem cell scaffolds can only be used when it is like a small lesion or like an isolated lesion. For a total repair, it is restricted to only surgical means.
Hello doctors and friends, my name is Jovita Teodoraliu with the last 3 digits 114. Now I will explain to you about the rehabilitations and prevention of meniscal lesions. The treatment for meniscal lesion is followed with exercise therapy. It has great results for meniscal lesions patients aged 18 until 40 years and highly recommended for 40 and above patients. It has a 12-week program, includes 60 until 90 minute sessions twice a week with different kind of exercises for each individual. There are 2 types of exercises. The first one is neuromuscular. It includes pelvic lift, side plank, stair, knee bends, outer and inner thigh exercise, slide sideways, and side lunge. The second one is strengthening lower limbs. It includes one leg press, knee extension, knee flexion, and kettlebell swing. The preventions for meniscal lesion has two types of strategies to avoid getting it. The first one is the primary prevention methods. This strategy is intended to reduce the risk of getting meniscal lesions by changing behaviors and maintaining new behaviors. The other strategies is the secondary prevention methods that includes noticing and monitoring individuals who are at risk. The risk of getting injured can be decreased by a method called neuromuscular training. By doing this 15 until 20 minutes, 2 until 3 times per week, the risk can be decreased by around 50%. Neuromuscular training includes multiple joint and muscle groups, close kinetic chains, and lying, sitting, and standing positions, depending on the patient's sensory motor control and the quality of the movement. The main elements for these strategies should be stretching, joint position sense coordination, and exercise that needs speed and force to build muscle power.
Okay, so my name is Catherine Angela and my student ID number is 2102511116. In conclusion, the knee joint, which allows flexion and extension, as well as a bit of rotation, is a complex joint that made up of 3 bones: the synovial cavity, many tendons and ligaments, the articular cartilage, bursae, and a pair of similar-shaped fibrocartilaginous discs called the lateral and medial menisci. An injury to the meniscus is called a meniscal lesion. There are 5 types of it: the longitudinal, horizontal, radial, flap, and degenerative or complex meniscus tear, which the latter is further divided into traumatic and degenerative meniscal lesion. The most common symptom of this injury is that a particular movement can't be done completely due to a mechanism called locking. This injury can be diagnosed by conducting physical examinations such as the McMurray circumduction test, the Abley-Green test, and the Tasley test, accompanied by imaging tests such as X-rays and MRI. Currently, this injury can be treated by suturing the tear, replacing the meniscus by using a meniscus allograft transplant, collagen meniscus implants, or polyurethane polymeric implants, with the latter 2 used for more severe cases. Afterwards, patients undergo rehabilitation, which consists of exercise therapy made up of neuromuscular exercises and lower limb strengthening exercises. This injury can be prevented by changing the habit that might lead to and monitoring the people who are prone to the injury. As for the suggestion, for those who might be at risk for this injury, correcting their habit that might lead to the risk factors of meniscal lesion is a must. For researchers, further studies for stem cell therapy should be conducted.